Hi, my name is Jessica Littles, and today I will be performing an abdominal exam on.
Marquise Littles.
Do you consent for the exam?
Yes.
All right. So the first thing I want to do with my abdominal exam is to make sure to look at the coloration of the abdomen, noting the contour, symmetry of his abdomen, knowing if he has any possible nevi or visible herniations to the abdominal area. I also want to look and see if he has any extra pulsations, possibly indicative of a triple A. Okay? So I know that his skin is within normal limits, intact, and no masses or herniations visible. Have you had any surgeries or had any trauma to the abdominal area?
No.
Okay, and then throughout the assessment, I want to know if he has any pain or he has any grimacing in his facial area. So next, I want to move over to auscultation. If you could you lay down for me? You're going to lay on your back. You can put your leg down. All right. Put your arms to your sides. I also, in this position, also want to know as well if he has any possible herniations and the colorations or any visible mass to the area. So I want to note the quadrants of his abdomen, which is the right upper quad, left upper quad, right lower quad, and left lower quad. Also noting the regional fields, which is the epigastric, the umbilical, hypogastric, right hypochondriac, left hypochondriac, right lumbar, right inguinal, and his left inguinal area. So I'm gonna just listen to you, and when I'm listening to see if he has any hyper or hypoactive bowel sounds. Usually you will hear bowel sounds within 5 to 35, but if he has a decrease in bowel sounds, it can be indicative of possibly constipation or ileus. Hyperactive, it could be due to him being hungry or any gastroenteritis as well. So I'm just listening to you. Okay. So what I was listening for is if he had any possible friction rubs in that splenic area or the liver. I'm also looking at friction rub would sound like a harsh rub in that area, in that location. And I'm also listening for if he has any possible bruise, which can be an indication of increased systematic blood flow to the area. I'm also listening for a possible hum in the abdominal cavity as well, which would indicate possible peritonitis. I'm also looking at his umbilical just to see if he has any blueness tint to the area, which can mean a decrease in blood flow to the area, which is also known as the Cullen sign. So next, I want to move over, after auscultating, I want to move over to percussion. And you just let me know if you have any pain while I'm percussing, okay? Or feeling my hands may be a little cold. Okay? And with percussion, I want to hear that timpani. And as I move and progress up around the liver area and the spleen, I want to hear more of a dull sound. Okay, that's more dull. And I'm just making a mental notation of his lower border. Okay. All right. So with that, I'm able to percuss his liver and his abdomen, since it's air filled and also filled with fluid. You have more of a timpani sound. So next, I want to move over to my palpation. And with palpation, I just want to do light touches in the abdominal area, and then we'll move over to the liver, the spleen, and the gallbladder. Okay, so my hands gonna be a little cool, okay? As I'm palpating, I'm just trying to feel if he has any possible mass that I did not see, noting the location if I do find one, consistency of the mass. Okay. All right, I'm gonna put my hand up on your back, and I'm just gonna feel for your liver. It's gonna be a little deep, okay? Okay, just let me know if you have any pain. Okay. Okay. So in your healthy clients, you will not be able to feel the liver, the gallbladder, or the spleen. But if he did have a grimacing or pain to that gallbladder area, it will be an indication of a positive Murphy sign, inflammation. I will warrant further testing for possible cholecystitis to the gallbladder. Okay. Next, I want to move over to checking to see if he possibly have any rebound tenderness. Okay. And this helps indicate if he has a possible appendicitis, inflammation to the appendix on his right side, and there will be a positive sign for appendicitis. Next, I want to move over for my clients that possibly have ascites to the area, which is fluid to the area. I can do what you call a fluid wave test, and also a shifting dullness test as well. So the first one we're going to do is the fluid wave test. So if you could, ask you to put your hand down, and it may be a little uncomfortable. Push down for me. And with your client that possibly has fluid, you will feel that movement of fluid to the opposite side of the hand and note it. Another test I did mention is the fluid wave test, and then the shifting of dullness test. With this, you will be percussing the patient's abdomen who has fluid ascites on the abdomen, and you're noting if you hear tympany, possible resonance, but you should also have that dullness. Once you get to the further up, you should hear dullness to the abdomen. You will ask the client to turn over, and when they turn over, that gravity or fluid will shift down to a more dependent area, and you would do your dullness test and note the results. The next test I can do for somebody who possibly has appendicitis is the ileoposis test. And with this test, I'm just going to ask you to push against my I'm going to ask you to lift your thigh up, and you're going to push the resistance to your right leg, okay? Can you lift your leg up for me? And push again. With this test, it will indicate if he did have any inflammation or pain. He would say he would have pain, sharp pain to that right area. The next test I'm going to do is the obturator test. And with this test, I'm going to place my hand up under your knee. I'm going to place my other hand right here. And I'm going to just ask you to bend. And we're going to turn your leg out laterally. Do you have any pain? Okay. I'm going to go in. Any pain? No. Okay. All right. And then one other test that I did forget to mention is just striking of the kidney area to check to see if he has any possible inflammation of his kidneys. Can you please sit up for me, Mr. Little? All right. And you want to just turn. Okay. And with placing my hands over his flank, I'm going to just strike. And usually you would do this with your back exam and know if he has any possible pain. He did not jump. He did not have any possible pain to his flank areas. All right. And you can turn for me. So with the results of his test, his abdominal exam was within normal limits. You can sit up. It's within normal limits. Did you have any pain throughout the exam?
No, ma'am.
All right. And I thank you and thank you.
Thank you.
All right.